Probably because for decades, if not 150 years, lawyers kind of wrap themselves in some sort of mystical voodoo. There was, lawyers were in some sort of ivory tower. In England, they still wear robes and wigs. It's intimidating. Plus, the first thing people associate with lawyers is money. If I call a lawyer, I'm going to have to spend money, and nobody wants to spend money unless they absolutely have to. So they don't go and talk to the lawyer. But if you don't have any damages, whether it's a car wreck or a slip and fall or a chemical plant blows up down the street, if you don't have any damages, you don't have a case. So the question is, do you have damages? Has someone else's conduct caused you damage? And if you have had damage, then we can figure out whether or not.
But don't you see, Mark, that maybe someone who was in an auto accident, they think they were fine, nothing broken, no cuts or anything. And then a week later, all of a sudden, that accident has caused them to have shoulder pain or lower back pain. Doesn't that happen?
Well, and Steve, in fact, that's the way it happens most of the time. Maybe not a week later, but a few days later. Because a lot of times when you've been in a car wreck or, even a slip and fall, all that adrenaline starts pumping through your body and those endorphins get going. And for a while there, you feel like you're fine. But a couple of days later, you're in fact in a great deal of pain. Well,
right.
If that happens, get yourself to the doctor. You try to let a doctor take a look at it so you can start down the road of getting well. And sometime after you've gone to that initial doctor visit, go talk to a lawyer.
So the doctor first, then you as an attorney second.
That's what I typically believe because, if you don't have a serious injury, you're not going to have a serious case.
Yeah, because like I said, our next question was from Grant and Plano. I just want to identify him. He said, what does a person do who's in an automobile accident and injuries don't occur until later?
Well, there's a difference between whether or not the injury occurred later or the pain occurred later. Now, it's really, really common that the pain occurs later, but typically the injury was done during the accident, whether it's a car wreck or a slip and fall. So I would use a little different choice of words there. It happens all the time. I mean, probably 45% of the cases are people that started to realize the severity of their injuries, a day, 2 days, 3 days later. And it's also pretty common to discover 6 months later that nagging pain that you had in your neck or your back was actually caused by a herniated disc that happened in the accident. Herniated discs, they tend to get worse over time. You can definitely feel the pain, not immediately after the accident, but days and weeks later.
I'm sure some people are going, hey, they spend half the time talking about things other than personal injury. I really think that, first of all, you've got to put a lot of trust into your attorney. And, I used to hate people that would select a personal injury attorney because they had the biggest yellow page ad. They knew nothing about that attorney except they had a huge ad. And, yellow pages definitely went away. Now it's the internet. But I really want people to get to know Attorney Mark Underwood because, boy, you got to put a lot of trust in him. And, especially if you've been injured, you want to know how your case is going. So a lot of times we'll spend sometimes 10 minutes, just something that doesn't have anything to do with the show. But, this is a free service. We don't charge you for this show, and we hope that you learn from it. And auto accidents, Listen, I remember in Dallas on 75 Central Expressway and on, I guess, LBJ. God, there was always accidents there. Is that still true?
Oh, Steve, I, you know, if the accidents ever stop happening,
Yeah.
if the accidents ever stop happening, we better start praying to God because that means the world has come to an end. There are accidents every day all over here.
Well, and I guess we've got winters right around the corner. And boy, I tell you what, when I was in Dallas, we had some brutal winters and we had a lot of ice storms. And sometimes you could just park your car on the driveway and the next morning it's in the street because it slid down. So this is such an important category. And the same thing with slip and falls. We did get um, we did get a lot of letters, Mark, about people wanting to know about pedestrian and pedestrian rights. Uh, but it's the same thing, isn't it? It's, if you were in an automobile accident, you can still sue the people.
Yeah, I mean it's kind of interesting. Um, if you're a pedestrian and you're either walking and fall or you get hit by a car, you're still going to have the same questions. Number one, do you have damages? Number two, was the other person negligent? Interesting little tip that most lawyers will miss is if we run into it pretty regularly, and a lot of lawyers miss this. If you're a pedestrian, you're walking across the street and you get hit by a car. It turns out that car doesn't have any insurance, or that car has only a very small amount of insurance in comparison to the amount of damages and injuries you have. You can actually make a claim on your uninsurance policy or your underinsurance policy. And to take it one more step further, let's say you don't own a car, but you get hit by an uninsured driver. Well, what are you going to do then? Well, as a pedestrian, you can actually make a claim on the uninsurance policy or the underinsurance coverage of anybody you live with typically. Now, that's governed by the terms of the policies, but most of the standard policies out there will allow you to make a claim on the insurance policy of anybody you live with under their uninsurance or underinsurance coverage for somebody that hits you in a car that's underinsured or uninsured.
Well, and we've only got about a minute left, but Mark, I just got two text messages, people wanting you, and we'll do this next month for your next show. Talk about what type of automobile insurance you should have to make sure you're covered properly. That's probably a pretty good little subject there. Mark,
that'll be a great show.
Yeah, we'll do that next time. And God, next time I see you is going to be after Christmas. So I hope you and your wife and kids have a great Christmas. And give everybody your phone number and your website address.
So, hey, the website address is underwoodlawoffice.com. Just spelled just the way it sounds, underwoodlawoffice.com. The phone number that's easiest to remember is 844. So that's toll free, 844 Underwood, 844 Underwood. And that'll get us in our McKinney location or our West Virginia location. And we're happy to talk to you. We hear some of the craziest stories. We got a call last week from somebody who was hunting up around Amarillo and got shot by one of the people on the hunt. And we have to do a show on that one. That's a good one, actually. And,
wow. Yes.
You want to talk about an interesting client interview. That's a really interesting client interview when you happen to be out on a hunt and somebody shoots you.
No kidding.
Yep.
Okay, Mark, listen, have a wonderful Christmas. Love doing your show. We'll see you next month.
Talk to you later, Steve-O.
Everybody. And that's attorney Mark Underwood. Love that guy. I tell you what, if you are ever in any kind of an accident or slip and fall, make sure you call Mark's office. We're going to go to break. When we come back, we've got our next expert.
And we are back with the Ask the Expert show on W4CY Radio and Talk4 TV with your hosts, Steve-O, Sophia, and their expert guests.
Yeah, we are back. And again, I hope everybody had a wonderful Thanksgiving. Sometimes we tend to eat a lot. So I'm so glad we have our next guest with us. She's an amazing doctor. And we talk about weight loss on here. And it's amazing the letters that we have gotten about Dr. Gamboa is how much they just loved her personality. So we've got a great doctor with a great personality. Let me bring on Dr. Gamboa now.
Hey,
you're like becoming a superstar on our show.
Thank you. How are you?
I'm doing good. Happy Thanksgiving.
Happy Thanksgiving to you too.
Wasn't
I was laughing
long
a
enough.
little bit because you were saying that we tend to overeat, and I'm like,
Yes.
oh yes, like that's what's happening. And I'm seeing that, like my patients today is like, oh yes, I'm sorry, like I'm a little like 5 pounds off, and then because I went to visit my aunt, my grandma, and like that, so it's pretty interesting. I'm like, don't worry about it. It's fine. It's only once a year.
I've got a great question for you. So I've been doing this show for 12 years now. And I don't know what it is, Dr. Gamboa, but this time of the year, really starting in about December, every clinic in the country wants to market weight loss. But it's only in December, January, maybe February. What's up with that?
Oh my gosh, it's marketing, of course.
New Year's resolutions?
New Year's resolution is like new year, new you, I guess, and all this kind of things that is like, okay, let's start over. Let's try it once again. And that's how it is. It's like whenever you fall from the horse, okay, you're back on, and then you can do it again. So, but that's very interesting, and you're right. Everywhere is like, okay, let's go ahead and for the new year or for the Christmas or all the holidays, let's get like health. Well, I don't like to call it skinnier. I like to call it healthier, because truly we lose weight not because of the looks, but we lose weight because of the health benefits that it brings. And that's what people need to understand. It's not because we used to think, oh, we want to be like models, like all this like skinny, like what do you call it, culture, right? But not anymore. We do it because of health benefits, because it's going to decrease your blood pressure, decrease your risk for developing pre-diabetes, decrease all the risk for developing cardiovascular disease and so forth.
Well, like I said, you have become a superstar. The people love your personality, and that's I call it also your bedside manner. We have gotten so many questions that we're going to start using on the air to ask you. People are writing in with questions for you. But first, before we do that, tell people about yourself and your practice.
Sure, Steve. Like I'm a family medicine doctor, and then I decided to also become diplomat from the American Board of Obesity Medicine. And I also do now, like I'm certified on hormone replacement, and I do also pellets. Basically I do the whole wellness thing. And again, all this for health benefits. And if you're healthy now, then we decrease the risk for all these chronic diseases. Then you're gonna like age well, and you're gonna be healthy, and you're gonna have a great quality of life. So that's what I want for my patients, to have a great quality of life.
And you also do functional medicine too, right?
I'm sorry?
You also do function medicine also, right?
Yeah, like I do, like it's a combination, even though I didn't have a full like functional like a fellowship or anything like that, but I do a combination of my traditional medicine, and also I do a lot of functional part with the wellness, the hormones, the supplements, everything works together to make you healthy.
We have an expert in our Atlanta area who went to Emory, great school, and he went there to be an OB-GYN doctor. And now all he does is obesity and function. But he said that they don't even teach you really anything about
Oh, yeah.
functional medicine in medical school.
No teaching whatsoever. And also that OBGYN most like told you that usually they don't get really trained on hormone replacement. Me as a family doctor, like we didn't do any hormone replacement. And that's what you have to learn later on if you want to expand your knowledge, if you want to expand your horizon, so to speak, and not just stay on your little, okay, this is what I was taught and that's it. No, like there's even more there, like, how to help patients in different ways, because not every medication is for everyone. That's why
Right.
you always have to look for the right option for you. You may have different sensitivities. You may have also like your ethnicity can play a role in this. So many things that are different, that you can respond different to many things.
It's amazing. We see there's so many commercials for weight loss products. If you walk into a GNC and you tell them you're going to lose weight, they go find a pill for you, right?
That's right. And then for your eyes, and then for your hair, and then for everything, right? Yes. It's
But
a multi-million industry.
what you do is you find out what the cause of it is. There's not like one pill is for everybody. And you've got so many different things in your arsenal that you can do. One of the things, Dr. Gambo, that we have gotten so many letters on, I don't think you're going to be surprised either. These injections.
Of course.
Everybody because some people heard the injections, there were some really bad side effects, but every one of them said, we heard it worked though for everybody, but they were concerned about the side effects.
Yes, like any medication, it may cause side effects, but if they are done the right way under like a physician oversight, and you're also improving your behaviors and doing some exercise, then you're going to have great outcomes. Like again, like with any medication, if you see like what an aspirin can do to you, you're never going to take an aspirin. So so like the same thing happens with these medications. But the thing again is to have it for the right person, because I don't know if you were aware of this, but one of the black box warnings is that it may increase the risk for a type of like thyroid cancer called medullary cancer.
Whoa, I didn't hear that.
Yeah, but when was this seen? This was seen whenever they were developing the medication, like with the rats and the lab. So they gave them like approximately 40 times the dose that we normally use. And that breed of rats, of course, they have like more type C cells in the thyroid that humans have. So we have very scattered, like not a lot. Of course, those rats, they developed a type of cancer that's medullary cancer. But since these medications have been in the market, like, for diabetes initially approved,
yes,
there has been no association between this type of thyroid cancer and the injections. So that tells you like some safety about it, right? But at the same time, if this person has this family history of this type of like medullary cancer or this other type of endocrine type cancers, we are not going to start this person in these injections, even though they do work, but we're not going to increase the risk. So that's why these medications have to be under physician oversight. It's not just anywhere that they can get it because they can get it or they can pay for it. And they don't know what they're doing, or they don't know what these medications can cost. I mean, it's for the right patients, and they really work. I have so many like success stories, and very few side effects, to be honest with you, because the minute the patients start having like side effects, then I have to like talk to the patient. Are they eating how they're supposed to? Are they eating smaller portions, not overeating, or not eating as they were used to, even if they were not overeating? Are they eating more fatty food than before? Are they eating more condimented? So all these things that we have to figure out. And if we need to stop the medication or decrease the dose, that's what we do. But honestly, my patients, they tend to tolerate these medications really good.
What is the percentage of weight they lose?
Um, for insurance purposes and for them to cover it, they just require 5%. But
Okay.
I've seen way more than that. Like they in the studies, they see that around 15%. And the newer one, the one that it's like probably you heard about it. Remember how we talked about Monjaro before? That was for
Yes.
diabetes. Now it has their the same medication, but for approved for weight loss only for obesity. It's called Zepbound. So this one in the studies have shown that up to 20% of the weight. But also, like honestly, like in my clinic, I have seen a little bit more than that because again, the patients are motivated, they continue to like exercise, they improve their behaviors, and they have been losing 50, 70, 80, almost 100 pounds. And they do great.
Well, I got a long letter from a listener who loves your show, and she's in Oklahoma City, listens to your show, and she's decided to get the surgery. And she explained to me that that's the first thing they do is the injections. But they also they have to go to a psychiatrist
Yes.
and a pulmonary. Why is that?
Yeah, it's a long list of like requirements for the insurance to cover them. So first, yes, you have to be evaluated first by the nutritionist. So then you have to try to do it on your own, lose some weight. Then like they have to put you in a low caloric diet for you to lose weight. Then after that, you have to visit the psychiatrist. Why the
Wow.
psychiatrist or the psychologist? It's because they have to evaluate you and they have to see if you're not wanting to lose weight only because of like sometimes patients may have like this dysmorphic body image from themselves
Oh,
and that's why they have to do it, or if they're not having any other mental health problems, even though, and that's what also like it's very important to know, obesity is being associated with a lot of depression and anxiety because again like it decreases your self-esteem and that causes a lot of mental issues. So that's why they have to also insurance companies and everyone, they have to understand that this is a chronic disease and we have to help the patients as a team, multidisciplinary, like with all this like specialists, because chronic this obesity causes all these chronic problems, and then finally they also want you to be evaluated by a pulmonologist because most obese patients are going to have obstructive sleep apnea. So they have to
oh,
have the test done because also if they are having lower oxygen levels, that's called hypoxia, and they don't know or they were not tested for that, they are going to have a lot of complications or they may even not make it outside from the operating room because they're going to be hypoxic. They may have more complications. So that's why they have to be tested for all these things before they say, okay, yes, you do this, check, check, check. And then you're like, okay, fine. You did everything you were supposed to. And now we are going to like approve your surgery. And that's how it works.
I got to tell you, I think you'll agree with me that when you're overweight, it causes so many health issues. Ones that people don't even I mean, sleep apnea is one of them.
Exactly.
High blood, all this. Why does the insurance companies not cover more things? Because, I mean, talk about saving money in the long run. If they could help now, there might not be heart attacks or high blood pressure or strokes down the road, which are really expensive.
Exactly, and also the quality of life. Like if a person already had a heart attack, or if they already had a bypass, or if they had a stroke, like the quality of life of those patients decreased significantly, and of course the money they spend in health and specialists and everything goes up and up.
Yes.
Unfortunately, what we see a lot is that problem with insurance companies, because I believe they think, oh, why invest in this patient if I don't know that tomorrow he's going to continue being with Blue Cross, just to give you an
Right,
example.
right.
Or he's going to change jobs or switch jobs and they're going to go and be with United or Cigna or any other big like insurance, or finally be without insurance. So that's why they don't really see the long term as you see and me, that I would love for them to see the benefits of this and then say, okay, I'm going to invest in this patient, and then this patient is going to be healthy, and then they're going to avoid all these chronic diseases. But they don't see it that way, unfortunately, because I think it's the portability, and they only see money, and they see, okay, I'm investing in this, but for how long? How, like, I'm going to pay his like $1,000 a month like medications, but then next year probably he's not even going to be our member, and then probably it's going to go to somewhere else, and then that's what happens a lot of the times.
Well, I'm hoping that people will be more aware, because I wasn't. Um, my weight caused me to have high blood pressure. But when you have high blood pressure, unless you go to get your blood pressure taken, you're probably not going to know. And I
Yes.
didn't know. And because I let it go, not on purpose, but because I didn't realize I had it, it caused kidney functions.
Yeah, it
And
causes kidney and heart and everything.
exactly, exactly. And I don't want the same thing happening to people. And I want to just, and I'll send you this letter. Um, I thought this was so cool. I don't know how we're getting letters from so far away, because this is a Dallas Fort Worth show, but we got a letter from somebody in Galveston, Texas,
Oh, wow.
that listens to the show, and she is getting ready to move to Dallas, but not until next year. But she is going to hold off seeing anybody because she wants to see you. And
Oh
I
my
thought that
gosh.
was a great, I
That's
thought that was a
awesome. Thank
great
you.
compliment. I
Yes.
gave her all your information, but sometimes you're so close to it, you don't realize how much information you're giving out, and the way you give it out, how it appeals to people, and they become, because what you do, I am telling you, I know for a fact that you really do save lives.
Oh, thank you, Steve. That means a lot to me, because what I want is educate the patients so that they can do it on their own. And that's what I tell them. This is not just a little weight loss program that we're here. These are the tools that you're going to do for the rest of your life. Don't think about being on a diet. Like, take that out of your mentality. Just think that you're in a healthy eating habits. And sometimes if you feel like eating pizza, go ahead and eat pizza, but just eat 1 or 2 slices at the most, and that's it. That's what I do, like, because we're all human and we also have to enjoy life. So we just like go ahead, and if you want like a half a glass of like wine, go ahead and do it, but just don't overdo it. Like anything is like that. You can do that. But yeah, that's what I want, again, to educate people, let them know that and the public, that this is a chronic disease, and that's how we have to treat it. It's not just for the looks, it's for
Right.
health benefits.
If you try to be 100%, you're setting yourself up for failure. There is a trainer, I think he owns a couple gyms in Dallas. Larry, I can't think of his last name now. Very famous in Dallas. And he used to say, learn to make better bad choices. It's not a lot. It's not about being 100%. And you can cheat once in a while. And I thought that was really great information. I know there's people who are listening to the show now going, it's Larry, and I can't think of his last name. But now, when someone comes to see you, do you put them on a diet on what they should eat or try to stick to?
Well, technically, like, first, whenever I see them, first I want to make sure that their sugar is well, and I check all the labs, because as you see, as you mentioned yourself, that happened to you with the blood pressure, but the same happens
Yes.
with the blood sugar. So you don't know you may be pre-diabetic until we check your blood sugar. And there's a test that we call it the hemoglobin A1C. And this one tells me how your sugar has been the last 3 months. So with that, I can have an idea if you are pre-diabetic or not. And nowadays, there's other tests also that I do that are like that help me with the insulin resistance. Because let's say that you still like your hemoglobin A1C is normal, but your insulin resistance is high. This tells me that in a year or two, you're going to become pre-diabetic or diabetic. So why wait until you go there if we can do something now? So, so there are many tests that I do because like patients, sometimes they think that I'm going to start them right away in a medication and everything, but no, like we have to first see what their baseline is, like what their sugar is, what the cholesterol is, how the thyroid is working, and also the blood pressure, because it all depends on the medications that I can use for you. If you have high blood pressure, I cannot use, like, for example, phentermine or medications that are stimulants. Like, so we have to see what we need to do. If I control your blood pressure first, then I can use this. So it takes time. And to answer your question about the diet, I give them like a frame of like an idea, you know. For example, I have like a little body scan here in my office, and we check it, and it's a very neat 3D. It makes like a 3D avatar of yourself, and they're like cameras that they measure you, and they kind of like estimate your fatty content and your muscle mass. And they also like calculate your basal metabolic rate. So how many calories you're burning and at rest.
Oh, how cool.
Like, yeah, that's just approximate, of course. It's not perfect, but it gives us an idea. For example, let's say if you have this done and it says that you're burning 2,000 calories, then we have to make sure that your budget of calories is around 1,500 to 1,800. We cannot go above that. Even if you are eating the healthiest diet in the world, you cannot go above what you're burning, you know. So that's why we give you an idea of how many calories you have to have in your budget of calories. And then of course, like we add some like resistant exercises, which has shown to be the best for weight loss. And that's what help us to start with that. And then we start the medications based on your labs. So it's a process, you know. I mean, it's not one time a patient came expecting to be starting in the medications right then and there, and I'm like, it doesn't work like that. We have to like do little by little. This is not just like drive through that. It's weight loss, okay? Like I need this, give me this, I pay you, and then like give me the medication. You know? Like,
hey, Doctor, do you give everybody your phone number?
Oh, my phone number is like you see, like now I don't know my phone number. 469-947-6020, and we're here in Las Colinas.
I love doing your show. I want you to have a Merry Christmas, and we've been told already next month to do a show on female. So we'll do that.
We'll do that. Let me know, and the same to you and your family. Have a blessed Christmas and have happy holidays and safe holidays.
We love you.
Thank you,
Dr. Gamboa.
Bye.
We'll be back with you next week with more Ask the Experts. Have a good week, everybody.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.